Because of the United States' involvement in Operation Enduring Freedom and Operation Iraqi Freedom in Afghanistan and Iraq, the U.S. military has seen drastic increases in members who have suffered TBIs, largely due to the tactics employed by the enemy: guerrilla insurgency with improvised explosive devices and explosively formed penetrators. My name's Zack Evans, and I work for Woods & Woods. I'm an attorney that represents veterans against the VA for compensation benefits. Today we're talking about traumatic brain injury ratings. The VA rates TBIs based on 4 categories, and those are discussed in 38 CFR 4.124A. The diagnostic code is 8045 for residuals of traumatic brain injury. The first of these 4 categories is cognitive impairment. This includes things like memory, concentration, attention, executive functions. Executive functions include goal setting, planning, organizing. This is one of the more difficult categories to bring forth evidence to prove your TBI severity level. And that's because of the nature of a traumatic brain injury. It's a lot different from, say, a knee injury, where we can look at an x-ray and we can see calcifications or bone spurs, or we can see on an MRI like a torn meniscus. We can observe the loss of range of motion in a knee injury. Head injuries, especially closed head injuries, are especially difficult to deal with, and in terms of objectively analyzing the individual symptoms that flow from them. So the reason for this is that a TBI isn't really an individual distinct disability in and of itself. Rather, it's a cluster of disabilities or symptoms that flow from a single event, the event being the brain injury. Another of the 4 categories that are discussed in 4.124A is emotional and behavioral dysfunction. So TBIs are often experienced as comorbid with mental health disorders. Usually the mental health disorder some level of severity will flow from the brain injury itself. The VA is instructed that if mental health is diagnosed and service connected, they should rate based on the mental health rating criteria. The truth is that the VA will sweep as many emotional and mental health symptoms into non-service connected mental health problems as possible. For this reason, I strongly recommend developing mental health alongside your traumatic brain injury, as well as headaches. And I'll get to that, the headaches specifics here in just a moment. But this means you're gonna need a few different kinds of expert opinions. Likely gonna need a psychiatrist or psychologist, and a medical doctor, preferably a neuropsych if you have access to a neuropsych. These are the types of experts that are qualified to administer TBI compensation and pension exams on behalf of the VA. And those are the types of opinions that the VA likes to rely upon. Another area of limitation as described in the TBI rating schedule is the physical and neurological dysfunction. These are things that can be readily observed. Motor and sensory dysfunction, headaches, which are very important, pain, seizures, gait, coordination, balance issues, incontinence, reflex problems. 38 CFR 4.124A assigns a point system based on all of these different categories. So you've got 10 facets, and this point system, as you rate each facet or category of impairment, gives you a raw score, and then assigns a rating based on the most severely rated category. So the raw scores are 0, 1, 2, 3, and in certain symptoms or categories, you have what's known as a total rating. And total is akin to 100%, or a finding of incompetence would be a good way to think about that. Someone who's consistently disoriented to one of the 4 aspects of person, time, place, or situation. The 0 raw score relates to a 0% rating, 1 to a 10% rating, 2 as your highest aspect score will get you a 40% rating. A 3 will get you a 70% rating, and then total is a 100% rating. The reason that I wanted to talk about the ratings and the raw scores in particular is because there's a VA regulation, there's a rule that's really important to understand when you're looking at TBI ratings, and that's the rule against pyramiding. Essentially, it just means that you can't get 2 separate compensable ratings for one disability or manifestation. A really good example of that is headaches. So I have an example here. Veteran Tom is service-connected for his headaches and traumatic brain injury. His headaches are due to his TBI, and those headaches are classed as subjective symptoms, so they're in the subjective category. And there is a CFR table that speaks to that under subjective symptoms. And the CFR table allows a max raw score of 2 for headaches, which corresponds to a 40% rating. But that's no matter how severe the headaches are. That's even if your headaches are characterized as prostrating attacks, which just means they require you to lay down and rest for the headache to subside. Diagnostic code 8100, under which migraine headaches are rated, tops out at 50%. Now, the VA is supposed to award the higher benefit, but often sweeps these into TBI ratings and uses it as a no man's land because TBI disabilities are so difficult to quantify and evaluate, and they'll just award a 0 on migraines and cite the rule against pyramiding. They'll say, well, we compensated you in your TBI rating and you actually received a maximum for that subjective symptom at 40%, but because we can't pyramid, we can't compensate you twice, you're not going to get the 50 under headaches. We see that all the time. That is inappropriate. Because of the overlap between mental health ratings, TBIs, and headache ratings, I operate on a TBI Rule of Three, which is that if you are pursuing traumatic brain injury, you should almost always develop alongside that mental health and headaches. You should do that in concert, and that is to hedge your risk from the VA trying to sweep severe symptoms that are, the mental health and headache ratings or mental health and headache symptoms as a result of TBI are some of the most easily recognizable, widespread symptoms that are suffered by TBI patients, veterans. They're demonstrable, so you can observe them. You can readily calculate how they affect somebody's life. And so they take those and they sweep them into other categories, other areas, and reduce the amount of your compensable TBI rating. If you have any questions about your traumatic brain injury claim or the rating that you're receiving or should be receiving for a TBI, give us a call or go online, visit us at Woods & Woods.